Good afternoon. This is Darren and Julia with the Mental Minute Baltimore. And as everybody knows, we started this at the beginning of the pandemic. Julia is a clinical therapist with a specialty in trauma and addiction. She recently published her first book, Crossing Paths, the intersection between trauma and addiction. I recommend everybody go out and get it. But also, she has her own practice, and she's here for the community. And Julia, we get questions in every day. And the question that we got today, two questions. What is anxiety and signs you might need help?
Oh, sure, absolutely. And this is a good one because I want to differentiate between some normal anxiety that we have from certain things and then what becomes more treatable, I guess, more that we want to worry about. And so anxiety is just this intense feeling of fear, dread, uneasiness, being scared about anything or everything. So, and again, this can be normal anxiety where we're kind of planning something and we're just anticipating it happen, or it can be every day. And anxiety causes biological responses. So there's sweating, there's restlessness, there's tension, racing thoughts, rapid heartbeat. All of that become how anxiety shows up. And if you experience this on a day-to-day over a prolonged period of time, that's kind of some signs that maybe it's not just normal anxiety from changes in schedule or from, big things that are going to happen. But a lot of the common symptoms that we look for that are continuous throughout the day would be, and through a longer period of time, would be just this feeling of restlessness or tension, a sense of impending danger or kind of like panic or doom, increased heart rate, increased breathing, trouble concentrating. And again, because anxiety is a broad term, when we look at it from a clinical standpoint, it breaks down into there's social anxiety, there's agoraphobia, there's so many different types of anxiety. So we really want to examine where this anxiety is coming from and what's causing it.
Thank you very much for that. And I did want to ask, so, and I think you maybe covered a little bit, but in that question, the parent asked, can excitement and anxiety kind of seem the same? I don't know if you can maybe elaborate on that a
Yeah,
little bit.
absolutely.
And
And
so somebody's trying to do something new they never did, and they are excited, but sometimes they might think it's anxiety. I don't know. Can you maybe explain a little bit on that?
yeah, so I'll give you my short answer. It absolutely can look the same. And this was kind of what I was talking about in the beginning. We have these bits of normal anxiety we get. And so what that does is we're stretching our nervous system a little bit. Normally we like to be in this kind of window of tolerance. And when we have anxiety with excitement or anxiety with play or something like that, it goes into this part of our sympathetic nervous system, which is this fight or flight, but it's a good fight or flight because what it does is allows us to stretch this nervous system for something we're excited for. So there's something we're expecting to happen. It's when our nervous system and our sympathetic nervous system in particular is continually in this fight or flight mode because of fears and anxiety over just even like waking up and we just wake up worrying. And so there is a difference there. And so excitement can show up, especially in kiddos. They get excited to go play, or that nervousness you get when you first cross the monkey bars or something like that. That's a good form of healthy anxiety that helps strengthen our nervous system. It's when it lasts long and there's no shut off that it becomes a little bit more worrisome.
Perfect. And the last question, Julia, is does anxiety look the same whether you're a young kid, a teenager, or adult? Can it look the same? I know it can be very, I just want to get your thought on it. Is there any way you can slightly maybe break that down?
Yeah,
If it
so it
does.
does look different depending on age. And one of the things that is common across is just this kind of this fear or this kind of impending doom, like something bad's going to happen. And again, we have to look at is it a normal anxiety, like am I planning a wedding type of anxiety, or is it like I just don't want to go out because I'm afraid something's going to happen, or I'm worried that somebody may say something or something along those lines. And so it really does show up differently for little kiddos. It's more of like this fear of, oh, I can't keep up, or I'm not going to be good enough, or I'm not going to do well enough in school. And there's constant worries. It's not just your normal, like, oh, I'm going to go run and jump and hopefully I don't fall. In adolescence, it's more of the perfectionist. The perfectionist worry for adolescents is really big, especially with school performance, sports performance. We see a lot of that. And then with adults, when it looks more like anxiety, it's just a constant worry about how everything's going to turn out, how everything goes. And it's very pervasive.
Julia, thank you so much. And like I say every week, just thank you so much for your time. You take time with your family, your practice, your writing, everything you're doing, just to do this with me for our community. Everybody that's out there, and we say this every week, if you maybe after Julia had just went through the anxiety and went through a couple of things, if you feel that maybe you have anxiety, a family member, one of your children, first of all, it's okay not to be okay. It's okay if you're going through something. It's okay if your child's going through something. But just seek out some help, seek out some guidance. And like I mentioned, Julia does have her own practice. She does do free consultations. I'll reach out to Julia or myself. And if we can't help you, we'll lead you in the right direction. Again, it's okay not to be okay. Like always, Julia, thank you to everybody watching. We do have resources on our Facebook page. Check it out. And if you have any questions that you want to ask us, just send them on over. Julia, like always, thank you.
Of course. Thank you so much.
You have a good evening, and I'll talk to you next time.
Thank you.
Thank you.